This is based on some of my colleagues in actually multiple centers around the world have looked at the mechanism of action of taxanes in prostate cancer, and one mechanism is acting on the interface, so not just mitosis, but in prostate cancer, what we're looking at is drug target engagement. So the hypothesis is that if the taxane is active and targets what it's supposed to, the microtubules, those microtubules are stabilized, and as a result, drug target engagement, as we defined in this trial, would be looking at prostate cancer cells, in this case CTCs, circulating tumor cells, and if there's active drug target engagement, the androgen receptor will not be able to translocate into the nucleus, so there'll be cytoplasmic sequestration of the AR, and the other aspect that we looked at was microtubule bundling. So what we did in the primary analysis for the biomarkers is we looked at, after one dose of chemotherapy, whichever taxane it was, we looked 1 week later and looked at changes between the percent of cells that had AR predominantly in the nucleus or in the cytoplasm. And as the hypothesis would have stated, the results showed that those that had the AR mostly sequestered in the cytoplasm were more likely to subsequently respond down the line to taxane-based therapy. Those that had AR predominantly in the nucleus following one dose of the taxane were a lot less likely to have a response. So that really confirmed our hypothesis that appears to be one mechanism of action. So besides just the preclinical data and the small number of patients that we and some of the Spanish group has had looking at circulating tumor cells and biomarkers, or circulating biomarkers, this is one that looks at the preclinical mechanism of action, looks at drug target engagement after one dose of chemotherapy, and fortunately really is in line with that hypothesis that after one dose of chemotherapy, it looks like that will predict who's more likely to have a subsequent response.